Hi, I'm Dr. Ruchi Garg, Senior Consultant in Obs and Gynae at Cloudnine Hospital, Gomti, Nagar in Lucknow. Today I'll be talking about hysteroscopy. What is hysteroscopy? Why is it done? And is it a safe procedure to go through? Hysteroscopy is when we try to visualize the inside of the uterus in a real-time scenario using a device called the hysteroscope. It is a pencil-shaped device with a high-resolution camera at one end. This is inserted through the vagina of the patient into the uterus under light anesthesia, and it is useful to diagnose many conditions of the uterus which may not be visible even on an ultrasound. It is a completely safe procedure and a daycare procedure, meaning that the patient is discharged after 3 to 4 hours of the procedure and can resume her daily routine activities on the very same day. Why is it used? And in which conditions will your gynecologist advise you to undergo an hysteroscopy? To name a few conditions where hysteroscopy is used. 1. In infertility. If you are a patient of infertility, hysteroscopy would be advised to diagnose certain conditions which may not be visible on an ultrasound, for example, a uterine septum. Second, you may be having a uterine polyp, which is a small growth in the inner lining of the uterus. This can be easily seen and also removed in the same sitting during the hysteroscopy. Third, if you have what we call as a submucous fibroid, that is small fibroids on the inner lining of the uterus. They can also be visualized and removed in the same sitting using a hysteroscope. You may also be advised an endometrial biopsy perhaps if you are experiencing bleeding after menopause or heavy menstrual bleeding. Endometrial biopsy is a targeted biopsy that can be taken using a hysteroscope. Hysteroscopy is a boon in the recent gynae technology. Thus, hysteroscopy is a safe procedure, it is a daycare procedure, and it helps us not only diagnose but also treat many gynecological conditions in the same setting.